Okay, so I would walk in and introduce myself. I would explain that I'm doing a head-to-toe assessment to our patient and the patient's guardian. I would then check the patient's wristband and ask their name and date of birth, and also verify the relative that is with them. Then I would wash my hands and provide for privacy. Okay, so first I would start with the top of the head, and I'm going to look. The hair is nice and clean. It has no lice and no lesions. Next, I'm going to go down to the eyes. I'm assessing for perla. The pupils are equal and reactive to light. And then I'm looking at the conjunctiva, and it's pink, then the white of the eyes are white like they're supposed to be. Now I'm going to look in the nose. The nares are painting and there's no discharge noted. I'm going to go back to the ears. I would pull them up and back if my patient was over 3 years old, and down and back if they were under 3 years old. Okay, everything looks good in it, clear, there's no drainage. And I'm going to look at the mouth. The lips, tongue, mucous membranes are pink and moist, like they should be. I'm going down to the neck. I'm just going to feel if there's any nodes. I don't feel any, which is good. I'm going to check the pulse in the neck. Then we'll check the skin turgor. Okay, it's brisk. Okay, now I'm going to go down to the chest. The skin tone is even. And I'm going to listen. I'm going to listen to the lung sounds. And then I'm going to listen to the apical heart rate for 1 minute. Okay, and I'm going to go flip them on the back and listen to the lung sounds there. Okay, good. While I'm at the back, I'm just going to make sure the spine is in line and the skin is even distributed, no bruises, no rash. Okay, everything looks good. And I'm going to look at the arms. Skin tone is even, no bruising, no rash there either. I'm going to check the pulses. Okay, then we'll check the capillary refill. Brisk, less than 3 seconds. I'm going to check the range of motion in the arms. Okay, good. Now I'm going to go down to the stomach, and I'm going to listen to the bowel sounds. Okay, I hear active sounds in all 4 quadrants. I'm just going to palpate. Patient had no tenderness, that the stomach was soft and flat. And then I don't feel the bladder as I palpated it, so that's good. Now I'm going to put on a pair of gloves, and I'm going to just assess the genitalia. Everything looks good, no abnormalities. The patient has no issues. And I'm going to wash my hands. Now I'm going to move down to the legs. I'm going to assess them. The skin is even. No bruising, no rash, no scabs. I'm just going to feel the pulses under the knees, at the ankles, and the pedal pulses. Now I'm going to do a capillary refill. It was brisk. And now I'm just going to do, I'll have the patient push on my foot or my hand, and then I'll have them pull it. That's good. I'm just going to check the range of motion. They have good range of motion. Okay, now I'm just going to ask them a few questions. I'm going to ask if they've had any trouble breathing or coughing, which they haven't. It's good. I'm going to ask when their last bowel movement is, the frequency, the consistency, and the color. And then I'm going to ask when they last used the bathroom, and if it looked like a normal clear to yellow, and no burning. And then I'll verify with mom that what the child has said was accurate. And I'm going to ask the patient or the guardian if they have any questions. I'm just going to wash my hands and give them the call out and record what I did.